Hello, my name is Davelyn Sawyerr and I'm going to be talking to you about Professor Christopher Balogun Lynch. He was born in Kampala, Sierra Leone, to a Reverend minister and a seamstress. He attended Holy Trinity Primary School and Sierra Leone Grammar School. He later on, as a teenager, travelled to the UK via boat with only £52 in his pocket. Professor Lynch worked as a porter in a paint factory, whilst taking a correspondence course to achieve his GCSE A-levels. He passed and won a scholarship to Oxford University, where he received his law degree. After graduating, he worked as a porter at St Bartholomew's Hospital, making plaster moulds for dental students. Through his friends at Oxford, who were studying at Bart, and his rugby playing skills, he got an opportunity to study medicine at St Bartholomew's Medical College, London, where he graduated in medicine in 1973. Following various appointments in London, Paris and Oxford, he became chief assistant to the Queen's Gynaecologist. His patients have included members of the royal family and heads of state. In 1984, he was appointed consultant to the Oxford region, based at Milton Keynes University Hospital NHS Trust, where he set up the Department of Obstetrics and Gynaecology. The professor's proficiency and professional expertise were able to deal with general obstetrics and gynaecology, but with a particular interest in managing hemorrhage at surgery, particularly postpartum hemorrhage, and colposcopy, pelvic infection, infertility, and cancer of the genital tract management. He introduced keyhole surgery to the hospital, having been one of the first few to develop this technique in the UK, back in 1989 following training in America. Professor Christopher B. Lynch pioneered the B-Lynch brace suture, a surgical technique that he developed and published in 1997.
I am known as the B-Lynch of B-Lynch operation. I invented the operation that saved women dying from childbirth.
The technique which can halt postpartum hemorrhage without the intervention of pelvic surgery, thus potentially preserving fertility. According to the World Health Organization, this procedure has saved the lives of more than 2 million people by 2016. Professor Balogun Lynch is also a commissioner for the World Health Organization for women's health improvement in Africa, and after retiring from public medicine in 2010, he returned to Sierra Leone to teach medical students and doctors under the medical organization Kappa Care. The then president of Sierra Leone awarded him the GORSL knighthood equivalent for his work and charity internationally. Professor Christopher Balogun Lynch, we salute you.